Is flooding an ERP a punishment for OCD treatment? Many people wonder if flooding in exposure therapy is a form of punishment for OCD. The answer is no. Flooding is an older, more intense way to confront fears, but it is not meant to punish or harm. Instead, flooding involves immersing a person fully into their most feared situation until their anxiety naturally decreases. It was more common in the past, especially in the 1970s and 1980s, but today it is rarely used because it can be very distressing and difficult to tolerate. Modern exposure and response prevention therapy, which is the current gold standard for treating obsessive-compulsive disorder, takes a different approach. It uses a gradual process called an exposure hierarchy. This means starting with less frightening situations and slowly working up to more challenging ones. The goal is to help the person build confidence and learn that their anxiety will lessen over time without needing to perform compulsions. This step-by-step approach is supportive and collaborative, not punitive. Think of flooding as jumping into the deep end of a pool without warning. It can cause shock and overwhelm. In contrast, exposure and response prevention is like gradually entering the water, allowing the person to get used to the feeling and become more comfortable. This method helps reduce obsessive thoughts and compulsive behaviors by teaching new, healthier ways to respond to anxiety-provoking situations. Flooding can be very intense and sometimes lead to people dropping out of treatment or feeling worse. Because of this, therapists prefer the gradual approach of exposure and response prevention. It has been shown to be highly effective and better tolerated. The main aim of this therapy is to help individuals manage their symptoms by facing fears in a safe, controlled way, not to punish them. In summary, flooding is an older, more extreme form of exposure therapy that is not the same as modern exposure and response prevention. It is not a punishment but a method that can be overwhelming and is used less often today. The current approach focuses on gradual exposure, patience, and support, helping people with OCD learn to cope with their fears without resorting to compulsions. Always remember, if you or someone you know is considering treatment, it's best to consult a qualified mental health professional to find the safest and most effective approach tailored to individual needs.